Let's talk about the 3 root causes of all knee pain. The first root cause of knee pain is weakness in your hip. Now, hip weakness can cause a certain type of knee pain, and it can also be correlated with other types as well. But one of the more common ones that we tend to correlate this with is called patellofemoral pain. So the weakness that we'll see in the hip usually occurs with the muscles on the side of the hip or in what we call the posterior chain, so like more of the glute muscle itself, the larger glute muscle. By strengthening these, we provide more stability to the knee joint itself. When these muscles are weak or aren't doing what they're supposed to do, one of the more common types of knee pain that we'll see is patellofemoral pain. So basically what that means is we have a kneecap that sits on top of the knee joint itself, and as we move our knee, that kneecap is supposed to shift and kind of move in a certain direction. Now if you see here when my knee is straight, that kneecap can move pretty fluidly. Well, as we go to bend our knee and lock it, the kneecap does not move as much. So the kneecap has to track a certain way within that knee joint. When we have weakness in our hip, it's thought that the tracking of the kneecap is then pulled in a different direction in which it's not supposed to go. So we'll get pain, and usually that pain's in the front of the knee. So by addressing the root cause of this type of pain in strengthening the hip muscles, we can get rid of patellofemoral pain. Now, it's not to say that that's the only type of knee pain that is caused by weak hips, but it is one component, and that is the most common one that we see. The second root cause of most types of knee pain is weakness in the quadricep muscles. So the quadricep is a combination of 4 muscles put together. They all have similar attachments at the hip or in the thigh, but they all have the exact same attachment down at the knee. So the attachment at the knee is either what we call the quadriceps tendon or the patellar tendon. So both of these areas commonly get aggravated in cases of a weak quad. So when a weak quad is asked to do more work than it's supposed to, so let's say you're not used to running marathons. You typically train for 5Ks, and the furthest you've ever run was a 5K. And you decide, I'm going to go out and I'm going to run a marathon tomorrow. And you go, you do this, and then you start to get pain in the front of your knee. You likely have overloaded your quad. So what you'll experience is either pain at the very top of the kneecap or below the kneecap at that tendon level. That's because the quad was not sufficiently prepared for the activity you were putting it through. So some of the things that will cause this weakness to happen is maybe you're not working out your quad in the gym. Maybe there's another underlying injury. Maybe there's hip weakness that led to the quad becoming weak. The quad itself is responsible for straightening the knee just like this. So the exercise that you would perform to treat this would in turn either focus on you strengthening the knee with your foot off the ground, or when your foot is on the ground, controlling the descent and coming back up to load that muscle. So as long as you're loading up the quad, you're at least moving the pillar towards treating pain that is caused by quad weakness. The third root cause of most types of knee pain is weakness in your hamstrings. So if your hamstrings are weak, they're not going to provide the support that is needed for all the internal structures of the knee. You have different ligaments and cartilage that really rely on a strong hamstring, or what we call like part of your posterior chain, as we had mentioned before, so glutes and hamstring. If those are weak and not doing what they're supposed to do, your knee does not have the muscular support. It still has the ligament support and the cartilage support, but it's lacking one pillar. And so if you fill that cup up or that address that other pillar, then you'll have a nice, strong, and supported knee. But without that, we become more prone to meniscus tears, more prone to damage to our ligaments like the ACL, PCL, MCL, or LCL. So one of the ways that we assess hamstring strength is we'll have a patient lay down flat on their stomach, we'll have them bend their knee to different angles, and then we'll test it on both sides. And if we see a weakness on one side versus the other, then we know we have to address that. But that's something we check here in the clinic. And then also we do that in combination of diagnosing what type of problem or where the pain is coming from. Most often we see this hamstring weakness correlated with meniscus tears in the knee. So if you're struggling with knee pain and you think you have weakness that is causing some of this, First thing I want you to do is click the subscribe button below to check out more videos on our channel, and then also give us a call or reach out to us via email. You can go to our website at p3physio.com and you can schedule a free phone consultation with myself or one of our other doctors.